Hey guys, so I know I'm looking rough right now, but this is almost 24 hours after my tubal removal surgery. I will do this story in parts. So I'm gonna kind of like count down from close to the end to the beginning. Right now I'm just gonna pretty much focus on the actual surgery. Then I'll get into the story of how I even came into the hospital. That's gonna be a different video. But as far as people who, want some insight on a tubal removal surgery and everything like that, we'll focus on that right now, and then stay tuned for the next video, which will be coming soon. So, long story short, with this video, I had a miscarriage, and the doctor told me that on my ultrasound, it was still a cystic fluid-filled sac that took the appearance of blood. So him and his partner had thought over it. I've been in the hospital for 2 days now. So they thought over it, and they came to a decision yesterday. No, I've been in the hospital for 3 days now. Sorry, I'm losing track of time. They came to a decision that they were going to go ahead and give me the surgery. Now, initially, I did not plan to get the tubal removal, but he did let me know that that was a possibility, and I signed my consent forms and everything. They kind of just wanted to do a laparoscopy and a DNC at first, just to see what was going on. So that's what I had initially thought I was going in for. But when he seen that it was an ectopic pregnancy. So he had to go ahead and remove my left tube while he was down there. So I have 3 scars, bandages. I got one underneath my belly button, one on my left side, of course, and then one towards like my vaginal area. So going in, at first I was nervous, but I have a history of endometriosis, so I'm used to getting laparoscopies. So I knew what to expect when it came to that portion of the surgery and going under anesthesia and everything. I was not used to, but this was my first DNC or miscarriage or, tubal removal. I didn't know what to expect with that. So I knew it needed to get done, however. So I went into the prep room with the anesthesiologist, and everybody was nice, everybody was cool. I had cool nurses. Like, my whole experience, everybody was warm and welcoming, so I kind of loosened up a little bit, and I just said a prayer before I went under. And honestly, I don't even remember falling asleep. I remember helping them transfer me to a different bed. It was like a flat metal bed with a sheet on it. And then they covered me up with like a blanket, because I remember it was really, really cold down there. And then they put like some of these, they put like some of these sticker things all on me. They might have to actually take this one off. I'm gonna ask the nurse when they come back in. But they put these all over me. So I just relaxed. What kind of at first scared me was that, I was trying not to chicken out, because I don't know, I've had plenty of surgeries with the laparoscopy in the past, but I was like younger. I hadn't had my last one in like 5 years, so I was just was nervous, So I just said a prayer, and I took a deep breath, and I just boom passed out. I don't even remember going to sleep. My surgery took 1 hour 10 minutes. I did not even realize when I woke up in recovery that this had just happened. Like, I remember going in, and that was it. That's the only recollection that I had, just going in, and how cold the room was, and when I just described to you all. So the person that was there, that asked me, they were telling me, wake up, and they asked me, how am I feeling? And I'm like, hold on, let me figure out where I'm at first. Like, I'm still loopy. I'm still just out of it. But I just told her, like, keep talking to me. Like, I'll get there. I did have a slight panic when I first woke up, and my heart started racing, and my monitor started speeding up, and she just kept calling my name, and I'm like, I'm here, and I just relaxed, closed my eyes, and I just tried my best to try to stay stable and follow the beeping noise, the beep, beep, beep. I tried to follow that to kind of slow it down. Then she was walking me through, you're doing good. So I kind of like forced myself to get out that daze and kind of like wake up and snap out of it. I just kept thinking about my babies. I have a boy and a girl at home already. So while I was down there, I asked her, how did the surgery go? And she said the surgery was a success, and the doctor did end up removing my left tube. She said that the doctor was upstairs, and I already talked to the child's father about details, and I can go upstairs in a little while and get those details. So, I just felt a sense of this happened. I already got my boy, I already got my girl. Of course, my baby will never ever be forgotten. I was 6 weeks pregnant, and like I said, I will get into the whole backstory in another video, but I was just like, you know what, I got my boy, I got my girl already. I'm blessed to even be able to say that and be able to have them. So I'm just going to focus on nursing myself back to health, and I know I'm grieving at the same time, but I have to heal mentally and physically also. So today is the day after my surgery. Right now it is 3:20, and I went into surgery yesterday at 7 o'clock p.m. It's 3:20 p.m. I went to surgery yesterday at 7 o'clock p.m. I got out of surgery. The surgery only took an hour and 10 minutes, but I had to go into like this recovery wake-up room, and I got out of there at like 11:09 p.m. So yeah, I was down there for a couple hours, but everything went well. Today is the next day. Oh, one more thing before my surgery, I was not able to eat from 3 o'clock a.m. that day. Remind me, my surgery was at 7 o'clock p.m. the next day. I was not, 7 o'clock p.m. that same day. I was not able to eat or drink from 3 o'clock a.m. that day all the way until today at like 9 o'clock, 9:30 a.m. So yeah, I went over 24 hours without eating or drinking. That was a struggle for me. However, they did keep the IV inside of me, so it got easier and I got used to it kind of like maybe around like 4 o'clock p.m. It was just kind of like, all right, I'm more so focused on the surgery than I am eating and drinking. And it's not even that I was actually hungry or thirsty. I did kind of lose my voice a little bit because my throat was, dry from drinking, but it didn't hurt. It was just like, starting to lose. But my lips were really dry, dehydrated. My face felt dry. I look rough now, but it was just one of them things where, first of all, I'm beautiful. I know that. So when you get in the comments, you don't even have to say, girl, you beautiful, stop apologizing. I didn't apologize for anything. It's just, I know that I don't have any like moisturizer or anything on my face that I normally would put, and it is making me feel my skin dry and uncomfortable. Everybody wants to feel smooth and comfortable, but I came here on a whim, so I wasn't able to bring anything with me. I actually drove myself up here, and that's a conversation that we will get into, I'm telling you. So fast forward, this is the next day. They set me right at like 9 o'clock. They had brought a egg French toast, 2 French toasts made with egg, and then they bought me like some stuff on the side, some coffee, and then for dinner I had some chicken breast, and some green. I mean, sorry, talking about greens. I had some chicken breast and I had some green beans and like corn and stuff, and it was nice. It was a nice, and some sweet potato. It was a nice breakfast and lunch. I may still be here for dinner time. I'm actually just waiting on the doctor. Once the doctor checked me out, and I didn't get to see him yesterday after the surgery, so today I'll be able to ask him my questions, and you know, he'll be able to discharge me. But yeah, I mean, pain wise, I am still in pain. Granted, I just had surgery. I am taking my medicine every 6 hours. I know that, you know, once I get home, it's going to be a little bit different. You know, I'm not going to have like a nurse on standby in case I need anything. But my mom has been a huge support with this, so I know she'll be able to help me and everything. My kids are very supportive. I know they'll be able to get mom whatever she needs, you know, so they'll be there for me. They'll come up the stairs, mommy, do you need anything? So yeah, I'm very grateful for that. I would say, yeah, I have pain right now, just like soreness from my stomach. I am, after leaving the hospital, going to be careful. I kind of pigged out just because it's like, oh, you know, I'm still here. So, you know, I haven't eaten since, you know, over 24 hours. So let me just eat, you know. But after this, when I go home, I am going to be more careful of my diet moving forward. I'm just going to make sure it's healthy. As far as having more children, no, I don't want any more children. I'm grateful with my tube, and I have 1 tube left. Yes, it is possible to get pregnant with that 1 tube. Another question I have for my doctor is, I've seen some online that says it might be harder to conceive because you only ovulate on 1 tube at a time. So this one, the right one I have left, might take months to actually ovulate instead of every single period. And then I saw another video where this woman was talking about ever since she got her tube removed, she doesn't really even have periods. She might bleed like 2 days out the month, but they're very light to the point where she doesn't even have to wear a pad or panty liner. It's only when she wipes. So I don't know. I just have questions. I can't really give y'all answers on that from my doctor because I haven't been able to ask him that yet. The only thing I would say is it's not as scary as it may seem, you guys. It's not as bad as it may seem. Just keep up, elevated, keep walking around so you keep that blood circulating so you won't get blood clots. They put like some weighted pressure things, some pressure packs on my legs. You know, when you get your blood pressure checked, and it's that thing, that bag that they kind of, you know, put around your arm, stick around there, and it floats up and down. See, my whole little hand is ashy. I need some moisturizer. It inflates up and down. Yeah, they put the same things on my legs. I don't know, it's like some type of special compressors. So they finally was able to take that off. I started to get the feeling back in my legs the next morning after surgery, probably like 10 o'clock this morning. I was starting to get the majority of my feeling. When I first got back from surgery into my room last night at 11, I wasn't able to move or like really feel my legs. I knew I still had feeling, but it's like my body was really too weak to lift them or walk. So they stuck a catheter in me, and I had to sleep with that catheter overnight. And then they took the catheter out early this morning. Well, I want to say, yeah, they took it out about like 11. They took it out. And I'm looking at the clock. They took it out like 10, 11. Yeah, that catheter was uncomfortable to come out just because I had to like lift my butt all the way up. My butt was uncomfortable because it was laying flat for so many hours between the surgery and the recovery. And I couldn't move to like adjust it. You know, my butt was just sitting there and I couldn't really prop up or anything. Now I'm moving a lot better. Like, I'm able to scooch myself. I will still have to go slow, and it will be like some soreness around my stomach area, but I could still like slowly scooch myself. Before I wasn't able to move at all, y'all. I could still get up and walk around a little bit just to keep circulating. So yeah, they gave me the okay to go in and wash up and change into some PJs. I kind of just like wiped myself down, like a little quick bird bath, and put a fresh gown on because I didn't know this was like spur of the moment, and I didn't have any spare clothes here, no pajamas or anything. So that's that. I am still in the maternity ward upstairs. So like I said, I'm gonna do a whole nother video to discuss my experience and how I got here from the very beginning anyway. But yeah, as far as a tubal removal surgery, laparoscopy, a DNC, you guys, you will get through this. I am so sorry to anybody who has ever experienced a loss, you know, a miscarriage, a stillborn, any of that. It hurts. It all hurts, and it hurts not only physically, but it hurts mentally as well. So it's just one of those things where we gotta stay strong, we gotta push forward, and we gotta kind of like continue with life and know that this isn't our fault. Don't try to beat yourself up about it. Let's touch on the DNC real quick. The DNC is when they go in there and they get out any type of remains from, you know, if you lost a baby and it's still some in there. I did bleed out the majority of my baby, but I was still showing up with HCG levels. It went from 600 last week to 400 3 days ago to 200 yesterday, and now it's like, you know, a quick couple of add-ons. I also want to tell you guys real quick for the DNC that I had bled the majority of the baby out. I will try to insert an image, or I don't know, put one at the end of the video or something of what that looked like. It was like a lot of brown tissue stuff. I did catch a picture at the end, and when I showed the doctor, he already told me that based off my image that looks like a miscarriage, and you know, one of the other doctors just walked me through it and told me that that's exactly what his wife went through, everything I told him. Like I said, I will make another video, but as far as the DNC, to prep me for that, they had stuck quite a few pills all the way up my vagina and just put some pressure on it, trying to hold it in so I could dissolve it. The day of my surgery, I had already stopped bleeding. I just had some spotting, like some remains still coming out. But after they inserted those pills, a few hours later, when, you know, I tried to stay laid down and everything elevated, but a few hours later when I got up to use the bathroom, I did start back bleeding, like bright red blood and everything. It was like a few clots. It wasn't nothing super alarming, but it just looked like a heavy flow period. But yeah, those pills definitely contracted my uterus as if I was 9 months pregnant, just so I can fully open up, so to make the surgery easier. That's the way the doctor explained to me. So I felt like the contractions and, you know, almost as if the dilation, I don't know if I'm using the correct term since this wasn't, you know, a full-term pregnancy. I was only 6 weeks, but with me having 2 kids already, I'm just telling you my experience and what I felt like from what I went through with my other 2 children. I felt like pretty much, you know, since no epidural, nothing was involved, since I wasn't that far along, I felt pretty much like I was preparing my body to give birth unmedicated. Like I had like a muscle relaxers for the pain, but it wasn't no type of heavy stuff like an epidural or something that I had with my other 2 children. So yeah, it was definitely the worst pain when it came to any type of, you know, I guess you want to say birth. It felt very raw, natural, and painful. That was probably the worst part of the entire experience. When I did wake up from my surgery, since I did have 3 different procedures done, I felt like it was a bullet or something in my stomach, like I had just been hit. And I don't know, it just felt sharp. And that's one of the reasons why I, freaked out with my heart racing when I first woke up, because all I felt was pain. And it's pretty much like the anesthesia wore off and I felt everything, once I came to. So I just want to insert that. Also, we're going to get into my experience with my child father and how that went, and how he even, came to the hospital, and what happened when he came to the hospital, and where do we stand now, where did we stand before. I want to be just transparent as possible and share my story, because I know there are plenty of women out there who have gone through similar situations, and I know what helped me when I was going through things and still are going through things is watching videos from other women just being transparent and inspiring on their story. So we finna level up. We finna talk about single motherhood, how to boss up, how to be an entrepreneur, how to focus on your children, how to, remain with your sanity, just everything. And I'm very excited to inspire somebody and help somebody the same way how other women on YouTube and stuff have been inspiring and helping me through this. And yeah, I'm gonna go ahead and cut to the rest of the story, but I just had to say that. I didn't really have, we gonna go into that whole thing. I'm gonna talk about what pregnancy symptoms I started with pregnancy symptoms instantly went away. How did I know I was having a miscarriage? I want to really get into detail, and I don't want this video to be too long because I really want to focus on the ones who had to get that surgery. So I'm going to make another video further detailing my experience with being pregnant and having a miscarriage, and then I'm going to make maybe another video of how I even got to the hospital in the first place and my experience within 3 days. So I don't know, I might tie those into the same video or just make a part 1, 2, and 3. But yeah, guys, just never give up on yourself. This is not your fault. And whether you do choose to or not to have children again, this is your body, your choice, and your decision. Don't let anyone make you pressured to change your mind. Okay? I love you guys. Love yourself. I love myself. And this isn't the end. You will be okay. Stay strong. Pray with God. And you are in good hands. Have faith, you guys. You'll make it. It's not as scary. I know it sounds scary, but the recovery is you're going to be right back on your feet in no time. Okay? Love you. Bye.